Hi, I'm Russ Rowberry. I'm an RNFA, which is a Surgical First Assistant, RN. I've been here since the first day that we opened this place, and I'm happy to be here still. I started out on med-surg over at the old Parkview facility and worked there for a year and a half, 2 years before we moved here to this facility. When we came here, I've always wanted to work in surgery. So I made arrangements and transferred down and as an LPN at the time, and it was just on-the-job training to be a scrub tech. The very first day when we moved over here, it was a little bit chaotic, but it was kind of an organized chaos. In the end, everything worked out very well. It was very well planned. We had every ambulance in town running patients back and forth from the old facility to the new facility. We were really excited though to come here. We'd all been through the open house and seen all the new the floors and all the new equipment that we got to work with, and we were all really excited about that. When I first set foot in this building, I went to the floor, med-surg floor, and I was excited that they had a tub that would actually lift up in the air, and we had new Hoyer lifts, which are the things that we'd transport patients that weren't able to actually move themselves into the tub. And it just made it so much easier. Rather than getting a bunch of us lifting patients around, we had equipment that would do that. And it just made the job so much easier, made it much more comfortable for the patients as well. One of the things that has changed is the way that we handle medications. I remember there used to be things that were just left out. That, I mean, today you would look at and say, oh my gosh, anybody could come along and just gather up those drugs and sell them on the street for an incredible amount of money. And I think back on that, and it almost makes me cringe to think that it was that way. We had one little lockup box that we put things in, and that was it. And anything that wasn't a high scheduled drug or medication was just kind of in a drawer. We used to do a lot of our gallbladders. They would be an open procedure where the patient would have an incision that was 8 to 10 inches long, and they'd remain in the hospital for a week, 10 days. Now we do a lot of procedures through scopes, very small incisions. The patient goes home that afternoon or possibly the next day, much less pain and heal much faster. When that technology came in, we were all very apprehensive about it, and it took longer to do than the former procedure of doing an actual open procedure, but the time frame quickly whittled down to where the surgeons were much better, and we were much better at helping them in those procedures. It's kind of exciting. I've got friends around the country that also work in operating rooms that I talk with occasionally, and there's very few things that we don't offer here that they have at much larger facilities. And it's fun to be part of that.